All right, we're live.
All right, good morning. It is March 16th. This is Senate Health and Welfare Committee meeting, and we we have really one um, order of business today, and that is to look at our letter of recommendations for H315, the fast track bill. And I guess I'm allowed to change my mind from time to time. So what I'm going to ask Steve Howard to do is to present the information that he has. And then after that, we're going to move right into the letter, and then we'll have some time for discussion after that. So Steve, thank you for being here. This is a very difficult time for us. It's tight, but please, you've got, 7 minutes. So if you don't mind presenting what
Sure,
you have brought to us.
sure. I'll be very brief. And hopefully you've received a proposed amendment that or language we would like your committee to consider. To sum it up, basically, we believe that now that the precedent has been set that some state employees are receiving vaccinations, there are groups of state employees who are we feel left out. And the basic premise is that the state of Vermont should prioritize its employees because employees who are performing functions on behalf of the state government should not get sick because of the work they're doing. So folks may know that the governor, when he extended access to vaccinations for teachers, he also extended it to state employees in public safety. And so the language that's before you would ask you to recommend that those vaccinations be extended to parts of public safety that we consider public safety that were left out, mainly family service workers who work for the Department of Children and Families and who have been going into people's homes throughout the pandemic to investigate child abuse and neglect. It would seem to me that that is an aspect of public safety that should not be left behind, and that those workers should receive priority for vaccinations, because unfortunately there are still many cases of abuse and neglect to be investigated. We also listed a couple of other categories of employees who, because of their work, are still working with the public and are still working in work sites that the state owns and operates, where they have they can socially distance, but they're working with large numbers of people. So for instance, our court system, while the traffic into the court buildings has been curtailed, the judiciary's employees have reported to work throughout the entire COVID-19 pandemic since last March. They've had some alternative schedules, but they have been going to work, and so we included them in the amendment as well. And that's just a catch-all in the language that we presented that just says that if their work duties must be performed on site in their duties, if they're a state employee and their work duties have to be performed on site, or their duties involve being in close proximity, less than 6 feet to the public or coworkers. So if there is a category of state employee who's not specifically listed here, they would come under prioritization for vaccination.
Okay, thank you. That's a very helpful. Let me ask one question then. Are you suggesting that this is going forward? You're not suggesting that it become any permanent. Are you suggesting it become a permanent provision in law? Or are you suggesting that it is going forward now during the emergency?
Going forward now in the emergency,
Okay.
that
Okay.
that basically
Right.
they be treated, especially the DCF, in the case of DCF, that they be considered public safety because of the nature of their work, and often they're going to these investigations with a law enforcement officer who has been vaccinated. So it just doesn't
Got
make
it.
sense that the worker isn't vaccinated as well.
Got it. Thank you. Thank you for bringing this to our attention. All
Thank
right.
you.
Committee, any questions of clarification? Senator Terenzini.
God, I'm overwhelmed by the number of people from Rutland on this Zoom.
I know, believe me, Senator Hardy and Senator Cummings and I get really overwhelmed all the time.
Well, Steve, it's always good to see you, sir.
Nice to see you.
I agree with. I got to say, I agree with you. I think especially the DCF workers. These people are on the front lines. They're going in and out of these homes. They're really some of our state's unsung heroes, and to not get them vaccinated as soon as possible, I think is a mistake. So I'm glad that you brought it up. So
thank you.
So,
All right,
Senator
that
Lyons.
sounded like a discussion, Senator Terenzini, but we'll let it go. Senator Hooker.
I'll hold mine for the discussion.
Okay. No, go ahead, Senator Hooker.
Well, it's simply, what's the process here? Is this going to be part of our letter? Does it have to be?
Well, that's a good discussion piece. We'll hold that for when we get Jen with us.
Okay.
Anything else? Okay, good. Thank you.
Thank you, Madam Chair.
Sounds like you've made your mark on this one.
I will now enter the world of YouTube and watch your deliberations.
You'll be sorry. Okay.
Thank you very much.
All right. So, Jen, good morning. How are you?
Good morning. Well, thank you.
So let's do this. I think, unless I'm hearing differently from any committee member, I think this seems like a lot of language to accomplish the goals that have been requested for our not frontline, but essential workers through DCF and others. We may want to add something to the letter, but let's go through the letter together. And I'd like to share with the committee how we got to where we are in the letter, and Jen can chime in as well on that. Are you going to share the letter with us?
Is that what I was just going to ask, is that what you'd like?
Yeah,
I can certainly do that.
Yeah,
just
I think
opening
that's
it up
good.
now. Okay.
That's good.
And I think you all received the letter already, is that right? Some people may have had an opportunity to look at it.
Nellie put it under my name, but it's, I worked with you and Stephanie. So, committee, just to let you know, as Jen goes through the letter, I'd like to share with you a little bit about the process for getting it to this stage. And that is, I went through all of our testimony and pulled up the things that we felt were important to include in the fast track bill. I also had some information that came to me about the what's known as RCC that we'll get to for the hearing impaired folks, the Vermont Relay Conference captioning, and then in communication with Stephanie Barrett from Joint Fiscal, received some information about the long-term care facilities and the difficulty of really putting that recommendation that we wanted forward at this time. So you'll see it's been placed for a longer term proposal in the budget. Then I met with Stephanie Barrett and also with Jen to have the language clarified that came to us from the after school program, and to ensure that the money that is coming from ESSER funds from education are being designated appropriately. And then finally, the language from the DAs and SSA's, Department of Mental Health, to ensure that we're covering all of the organizations that provide support services, both as sort of within the agency and outside of the agency. And I've since received further recommendations from Julie Tessler for improvements to that. And so if we have time, we'll get to that as well. But I just wanted to let you know, it's been a long, it was an over the weekend event. And then working with Jen yesterday and Stephanie Barrett to get this together. So here we are. So Jen, why don't you walk us through the letter?
Great, will do. So Jennifer Carby, Legislative Counsel for the record. So this is styled as a memo from your committee to the Appropriations Committee, and we can update the date as appropriate. It just talks about you having reviewed and taken testimony on H315, the COVID relief bill as passed by the House, and that you have recommendations, and you're also identifying additional areas of interest that you want to continue exploring with appropriations for potential inclusion in the budget. So we look first at the H315 recommendations. The first is expressing your support for the $1.3 million appropriation for continued additional financial support to Reach Up families. And you're deferring to appropriations in determining the proper funding source. Next is purchase and distribution of diapers. This is a recommendation to appropriate $82,000 to DCF for a grant to the food bank to purchase and distribute diapers to Vermonters in need. Then we have the recovery centers. This is a recommendation for $240,000 to the health department for the recovery centers in the Vermont Recovery Center Network. That would work out to be a $20,000 grant because there are 12 recovery centers. And this would help address the increased need for substance use disorder treatment services and therefore the increased caseload that the centers have been experiencing as a result of the pandemic.
Madam Chair, do you want us to ask questions as we go or wait till the end?
Go ahead.
Okay.
Go ahead.
I was trying to find this in my notes. Is this the amount that we got testimony recommending, the 20,000? Or
yeah,
how did it come from?
Yes, actually we did when Peter Mallory and I forget his first name, Groton were in to testify. Peter Mallory's testimony and his verbal testimony included some dollar figures there of loss that they had during COVID. And so this kind of matches that testimony. So it's in a ballpark area. Let's put it
Okay,
that way.
it's rounded. Okay.
Yeah, it may be rounded quite a bit, but it will sort of compensate for the work that's been going on and for which they haven't had sufficient resources.
And the funding source would be left to the Appropriations Committee, whether it would be federal
Yep.
or
Yep.
general fund.
Yep.
Okay, thank you.
Yep.
And Senator Lyons,
Go ahead.
before we get too much further into the letter, going back to Reach Up, the 1.3 million is the recommendation from the House. This doesn't address the base funding. Are we going to talk about that later?
So any base funding discussions or this will have to be held. These are not base funding discussions. So that we'll get to that when we get to the big bill. We can't put all the base funding recommendations into this letter, but that certainly will be one of them when we get to the budget.
Okay, thanks.
I
All
guess
right.
just to follow up on that question, Senator Hooker, sort of my decision making on what to include at the end of the letter for considerations under the budget were those things that we might have wanted to include in the letter, but seemed more appropriately put off. So Reach Up base funding is an ongoing issue, and I'm not sure that we need to put it in at this point.
Then we get to the designated and specialized service agencies, the DAs and SSAs, and the housing language in the House that had been housing support. So I just put that in parentheses. And it has you recommending amendments to sections 4 and 5 of the bill as passed by the House, which address housing issues and the DAs and SSAs. And so I've done a markup version of your potential recommended revisions to the House passed language. So again, taking out the word supports, still having $4 million, but instead of it coming from the general fund, having it come from the new federal money. That's the American Rescue Plan Act of 2021, Coronavirus State Fiscal Recovery Fund, to the Department of Mental Health in FY21, so this current fiscal year, for grants to Vermont Care Partners and other stakeholder organizations to make, and instead of to provide housing supports, it would be to make existing housing and community-based facilities providing mental health services more accessible, safe, and compliant with the Americans with Disabilities Act, ADA, or to expand housing opportunities in community settings, or both. The department would still be directed to select the projects in consultation with folks, but this would add the Agency of Human Services Secretary's Office and the Department of Disabilities, Aging, and Independent Living, DAIL, in addition to the representatives of the DAs, SSAs, and peer organizations. The grants would continue to be awarded to organizations that demonstrate the greatest ability to respond immediately to the need for housing, again, taking out supports, and shall be for projects that would not require additional state funds for operating costs in future years, or that can redirect current expenditures, or both. To the greatest extent possible, grants would be awarded for projects in underserved areas of the state, and at least one grant must be awarded to a peer-run or peer-directed housing organization. Then it has new language saying the Department of Mental Health must partner with the AHS Secretary's Office and DAIL to identify ways to include as potential grant candidates those specialized service agencies that do not provide mental health services. And then takes out the consultation with the various groups for priority, and just says priority shall be given to proposed projects that, and instead of meeting one or more of the following criteria, they would need to meet what had been 1 and 2. So priority shall be given to proposed projects that create movement within the current system of care, such as those that would move individuals out of hospitals and other restrictive settings and back into a community setting, and focus on equity and on providing patient-centered care. So those are the potential changes to the housing piece. Do you want me to stop there before we look at the next?
Yes, I think you should.
Okay.
So, and I think that to clarify a little bit, in conversations with joint fiscal about any requirements associated with the funding, I think that some of the language changed from what we had earlier, and then some of the language changed as a result of requests from DMH that we had in committee Friday. Was it Friday? Yeah, I think it was. Okay. So committee questions on this. I know there are concerns that are being expressed from Vermont Care Partners. They suggested that we take out some of the language that was recommended, and I'm really loath to get into another long debate on this, but I'm very sensitive to what Care Partners' needs are. On the other hand, we need to get a letter to appropriations, and then appropriations is going to have to do two things. One, they're going to have to put language into the bill, but then they're also going to have to negotiate across the aisle with House appropriations on the bill before it's finished. In the meantime, it may be helpful for us to hear what Vermont Care Partners has to say about this. So all of which is to say, I appreciate the folks who are watching in on YouTube and their recommendations, but we have such limited time that any changes will probably have to be done either in appropriations or by proposal amendment or within the conference negotiation process. And committee, I ask you for your thinking on that. Senator Hardy.
Yeah, thank you, Madam Chair. I guess my biggest thing is I would like to advocate for recommending more funding than just the 4 million. I think the 4 million was the amount that came over from the House. We've since then gotten, confirmation, a vote in Congress that we're going to get even more funding for this area. And the Vermont Care Partners and the local DAs identified $16.8 million in facilities costs. So if we have additional money, I would really like this committee to recommend a higher amount than just 4 million.
I mean, we can do that. It certainly is warranted based on need. I think what we heard from joint fiscal is that there are certain requirements associated with the dollars that we have. We want to make sure we're using them appropriately. The other thing is, the more capital expenditures we do, that is expansion of any housing. So this is existing housing and community-based. If we expand to new facilities, then that involves some ongoing expenditures, which are best met within the budget process. So there we get put between a rock and a hard place, but we can put up to
Yeah,
4
they
to
have.
26 million. I mean, I'm with you, Senator. These
Thank you.
organizations can use as much as we can give them.
What they have in their request or their is 7 million for renovations and upgrades, and then 1 million for repairs and maintenance, and 8.8 million for new facilities. So even if we're just talking about repairs, maintenance, and renovations, that's $8 million. So we could recommend up to 8 million if we want to be bold and say that this is what's identified as a need for renovations and upgrades and repairs. And it does include things like air filtration systems, which, as we know, has been a really important thing for schools. And it seems to me that these facilities warrant that type of attention as well. So I guess that would be my thought.
Okay, so I would say we can do that. There's no reason why we can't put that in as a request. Certainly the Appropriations Committee will have to determine whether or not that can happen and then how much. But Senator Hooker, Senator Terenzini, would you be okay with increasing that amount?
I'd certainly be okay with increasing it. And my question is, does this include like Pathways as one of the organizations, as the type of organization? And how would it relate to the renovation monies that are going to be appropriated from economic development for local landlords to fix up houses? I mean, how can we?
This is directly to DAs and SSAs. So for their step down needs, their transitional housing needs, the relationship with other funding is something that has to happen in appropriations. So there's no way that we want to get into that discussion. I know it's important
to see that
is
kind of
appropriations
out there, so that
yeah, it sounds like a lot of fun.
Things seem to be reasonable. And again, with Pathways as one of the organizations working with the SSAs, working with the DAs, I mean, I'm
trying to remember how we left that one, Jen.
I believe that's true. So the grants to Vermont Care Partners and other stakeholder organizations, they could certainly be a stakeholder organization. And then down here, representatives of DAs, SSAs, and peer organizations. I think Pathways is a peer organization.
Yeah.
So and may also be an SSA in its own right, but I would defer to the representatives to clarify if necessary.
Yeah.
Senator Lyons, can you see me or hear me?
Yeah, go right ahead.
Yeah, you had asked my opinion quickly on this, and certainly I would be in favor of seeing an increase in this number as well, and would support the committee's decision on that.
Okay, so Jen, let's put it at $8 million. The appropriations will love to see that coming, but if it's available and it meets the request, then so be it.
We'll put it in here right now.
Whoop.
And I don't know, maybe we would want to also include something here.
Yeah. Yeah, I know what you're gonna say. Go for it.
Increasing. Something like that.
Yep, that's good. Okay, let's scroll down. Is that good? Let's go down to,
All right, so then we have another, this is still in your revising the language. This is what was section 5 in the bill as passed by the House, and we've left the section numbers out, not knowing how they will number things in the Appropriations Committee. But this is the appropriation to the DAs and SSAs, or for the DAs and SSAs for case management services. And so it doesn't make any changes to the underlying language that came over about appropriating funds from the general fund to the Department of Mental Health for funds to the DAs and SSAs so they can hire additional case managers. But it would add language at the end directing the Department of Mental Health to partner with Dale to identify ways to fund the priority case management needs of specialized service agencies that do not provide mental health services. So that may be outside of DMH's scope, I think, is the intent here. So they would work with Dale to include those SSAs as well.
okay. We're good. All right.
All right.
Yep.
Then we move on to after school and summer programming. And this would be a recommendation to appropriate $4 million for after school and summer, it has and programming, summer programming as follows. So a new section that would appropriate $4 million from the funds provided to the state by one of the education sections of the new federal act to DCF for distribution to the After School for All program, and directs that the funds should be used for grants to after school and summer programs that meet the requirements of particular provisions within the federal act that require certain amounts, at least a certain amount of funds to be used for particular purposes.
Yeah, so this is a lot, it's a lot shorter than what we had gotten. I know that the Education Committee has language that they're submitting, but what this does is it ensures that the money that's being used is able to be used and that it goes appropriately from AOE, the URSA funds, to the Department of Children and Families. And so we had help here from Stephanie Barrett to make sure that the language would be appropriate as it goes to the Appropriations Committee. Questions there? All right. Now we'll go on to the next one, which is
Okay.
which has one little misspelling.
Uh-oh.
One extra letter.
Oh, Ken, that's why I didn't like it.
That's why I didn't like it. Yeah, I just
you.
noticed that.
This is why I like opening up the Word document. I can make changes as we go along. So this is what the chair had mentioned around Vermont Relay Conference captioning. This would direct, and I have to say, I wasn't sure if it should go to DPS or Dale. It sounds like the program has been, or PSD, the Department of Public Service. It sounds like Public Service has contracted for it in the past, but it may be a bigger priority for Dale. So in this case, I've appropriated it to Department of Public Service, $50,000 to restore the Vermont Relay Conference captioning service, which provides free captioning for video and conference calls for individuals who are deaf or hard of hearing. The department shut off the service after expending all of the funding it had allocated for that purpose and needs these funds to restore the service.
So it had $20,000, and so after it used that amount up, it shut off. So the exact amount is, it's much more probably than 20,000 because of the timing. So 50,000 seemed appropriate as a request. And I did hear from one of the advocates who works with the hearing impaired about this, and so added it in. The money ordinarily comes from the Universal Service Fund for this work. And so if you're on finance, you hear about the USF from time to time. This money would compensate for the need that's increased as a result of COVID.
Yeah, Madam Chair, since my other chair is not here, I'll just say that in finance, we also included this as a recommendation in our technology and broadband funding recommendations to the Appropriations Committee.
Good.
And I believe there's a change in the Universal Service Fund percentages that should take care of this. But just this is consistent with what the Finance Committee recommended. But I don't think it will be general fund, so.
No, it won't. But thank you. That's good. I think it doesn't hurt to have more than one committee weighing in on a topic like this. You know, it's similar with what we have for education.
So,
All right.
So again,
Senator Hooker.
yes, so this would be a one-time appropriation, and then would we have to look to the Universal Service Fund to have sort of a base funding for them at some point?
Yeah,
So that's the Finance Committee's responsibility. And so it sounds like from Senator Hardy, what Senator Hardy is saying, that they'll be following up on that. That would be great.
yeah, there's a bunch of problems with the Universal Service Fund that we've been working on, but it is also, the demand has increased significantly this year. And that's one of the reasons they ran out of money, because there've been a lot more conference calls for obvious reasons. So they ran out, and it's not generally that such high demand for this service, but it has been this year.
Okay.
Who knows? You know, it may continue. We don't know, right? Okay, so those are all of the recommendations that we have for expenditures of funds. And then, Jen, why don't you go right ahead through our 2022 budget recommendations? We
Right,
put
so
some
as the-
things down here.
Right. And so as the chair said, that kind of ends what you're specifically recommending on H315. Then we get into what I call preliminary budget recommendations.
Can I I'm sorry to do this to you and interrupt, but is there an interest committee in adding language that Steve Howard has proposed, or some modification of that language to ensure that folks who are social workers and others who are working with clients or the public in less, at a distance of less than 6 feet, maybe should we put that in with H315 before we jump into the budget? Go ahead, Senator Hardy.
Yeah, there's a section at the end of this letter, the COVID-19 vaccine section.
Right.
And I had some questions about that. And I was thinking maybe we could talk about vaccines just in general in that section rather than adding it to 315.
Okay, well, don't worry about where we're going to add it. I guess my general question is, do you want to add language related to what Steve Howard presented to us today?
I'm definitely supportive of having the social workers, the frontline workers vaccinated. However, there are other populations that are also really concerning to me. And so it sort of becomes this,
A litany.
avalanche, I mean,
A long list.
it's a long list, and I know our vaccine doses are still limited. And so I feel like maybe we, I don't know. I mean, it's definitely worth a conversation, but I'm concerned that there are incarcerated individuals that haven't been vaccinated, and that doesn't seem to be a plan or a focus on making sure that we get people who are in our.
Okay, can I ask, hold your thoughts until we get there, but my question was only this. Are you interested in having some language, perhaps similar to what Steve Howard presented to us, included in our recommendation? Yes or no?
It's not as easy as a yes or a no. I think that once we say yes
or no,
we need to talk about all the groups and having general language about priority groups.
Yeah, that would be a yes. Okay, that's good.
Madam Chair,
Yeah, no, it's a yes, but it's a modified yes. I get it. we're good.
It's a larger conversation. It's more complicated than
No.
just saying yes or no to Steve Howard.
Nope, I understand that. I understand what you're saying, Senator. The concern about having recommendations for vaccinations. Okay, let's go back to the letter and we'll go to the budget recommendations and then we'll land on vaccines at the end where it is in the letter.
Okay, so these are preliminary budget recommendations. These sound like issues that the committee has identified as potentially wanting to pursue or have the Appropriations Committee aware of and pursuing, but also didn't want to foreclose the opportunity for you to have additional budget recommendations when the budget comes over. So I called them preliminary budget recommendations and said that you were providing this time for informational purposes and in case the Appropriations Committee thinks something is more appropriate to put in 315 than to wait for the budget.
So that
So it-
one, yep, go ahead.
So it starts with long-term care facilities and expresses your interest in exploring the potential use of federal, maybe we want to say rental housing funds, but to provide support to long-term care facilities that use lease agreements and that lost revenue during the COVID-19 pandemic. So seeing if there's a way for certain long-term care facilities to fit under the parameters of that federal program. And we have addressing homelessness and ending reliance on motel vouchers. Here you're recommending identifying opportunities to use federal funds to make capital investments to address issues relating to individuals who are experiencing homelessness and to provide them with necessary related supports. Then we have primary care workforce development. This would recommend appropriating funds in the budget to further develop Vermont's primary care workforce by investing monies to recruit and retain high quality primary care providers in all areas of the state. And then I added this language, I don't know if it's what you want or not, but to take it a little further, especially those areas that have a significant shortage of primary care providers who are taking new patients. I know that seems to often be one of the concerns, but we don't have to limit it to that. Then we have foster parents.
Why are we limiting it to those who are taking new patients?
It was just a way to focus on something. I know sometimes when it talks
Yeah.
about, when people talk about all areas of the state, there's particular concern about shortages in certain areas of the state. And then what often seems to be the issue there is that even if there are providers, their practices are not taking new patients. They're only seeing existing patients. And so that's where a lot of the lack of access
right.
seems to come from.
Yeah.
But it was just a thought to have something more to get people's attention. So if you want to limit it,
The definition of new patient would be interesting. So we'll just leave it just the way it is.
okay. Or we could stop it after providers if you prefer and focus it on areas that have a significant shortage.
Let's just leave it after providers. What do you think, committee?
I think Senator Lyons, I think
Yeah.
that was the intent of 123, which is the, primary care provider workforce development bill. So.
Yeah. Okay.
Great. We'll take out that last piece. And we have foster parents. There's a recommendation that appropriations consider providing additional financial support to Vermont's foster parents in the FY22 budget bill. And then finally, we have the vaccines. And this says you don't have a specific funding recommendation at this time, but expresses your concerns about COVID-19 vaccine distribution in underserved areas of the state, especially in Essex and Orleans counties, and that you wanted to call the Appropriations Committee's attention to this issue and the potential need for the health department or someone else to offer vaccination clinics, mobile vaccine administration, or other methods in order to ensure that Vermonters in rural areas have appropriate access to the COVID-19 vaccine. We will continue to monitor this issue and may have a funding recommendation to provide for the budget bill.
So this one came from a number of communications that I had, both from senators and constituents. So and I'm wondering at this point whether, this would, I guess, Senator Hardy, I see your hand is up. then this one, we can't really identify money to put in for this, but it does. I mean, for me, it's an immediate need, and it may well be moved up when it gets to appropriations, but I'm listening. So go ahead, Senator Hardy.
And do you want me to take this down for you to have that conversation?
Yeah, let's take it down for now. Oh, that's so much better.
So
Hello.
this is where I was thinking. So in looking at this, I looked at the Department of Health dashboard on vaccinations and looked at those two counties, and actually, you know, Essex is the lowest in the state in terms of percentages of vaccinated, but Orleans is not. They're kind of in the middle. In fact, Addison, Franklin, Wyndham, and one other, Orange County, all have lower vaccination rates than Orleans County. So I don't really think it's appropriate to call out Orleans County specifically, because they actually are doing better than many of the other counties.
Do you want to call out any county?
Well, what I was going to suggest here, and this would cover all the bases, including the
Go
Steve
for
Howard
it.
base, is that
Good.
we would say that we, you know, want to call attention to specific populations that are potentially underserved with vaccinations, including very rural populations. Oh, are you okay, Madam Chair?
My ear dropped out, so I missed everything you said. Go ahead.
Okay, so I was thinking of just saying just more generally, so very rural populations, Vermonters of color, because if you look at the percentages of BIPOC people who've been vaccinated in our state, it's much lower than white communities. So those two, also incarcerated individuals, and then frontline workers who have not yet been vaccinated, especially state workers who
So
are.
I would change the language from frontline to essential. Frontline workers are healthcare providers and others who work directly with patients who may have or potentially contracted COVID. So that's the language I think the Department of Health is trying to utilize. So maybe we should say essential workers there.
Well, I
But I get
actually,
it.
my understanding of the Department of Health is it's the opposite, that the commissioner has specifically said frontline workers. He wants to avoid using the term essential workers because it's divisive. And
That's
so,
right, because it leads us to talk about people who work in the courts or as social workers or others. So what we want to do, I think the way I think, and I'm gonna as you're talking, it is the close proximity to the public or coworkers that actually Steve Howard has identified in his memo. And remember, we ask state workers by guidelines and direction to work with people. We direct them to do that. And so the public safety folks have been protected in the process, including now guards at correctional facilities. The vector for communicating disease are the guards to prisoners. I think the DCF workers that are going out and meeting with children and families put themselves at risk, including social workers and others. So I have a lot of empathy and sympathy for those folks who are directed by the state to do work with people. So it's hard to, and I agree with you, Senator Hardy, it's hard to define the whole universe.
right. So that's why I was suggesting a list of people who we've heard of being underserved, very rural people, people of color, incarcerated individuals, and frontline state workers that are what is the term that Steve uses?
Work-related exposure.
That have
Greater-
work-related exposure.
Greater risk for work-related exposure.
we can avoid using frontline or essential.
That's what I
and
was
just
getting at.
have Jen define it with, and so that we just identify these 4 groups of people that we have heard need more attention for vaccinations.
And
That would be
I
my
guess
general suggestion.
that's very good. Thank you. Those are good suggestions. And I would say probably perhaps putting the state workers first and then going through, because I know attention is being given to the BIPOC community. And the Department of Health is focused on providing additional clinics for some of the groups that you've listed, but that we can still list them ourselves because we know there's a need there. Senator
Yeah.
Terenzini.
Thank you. And I apologize, Senator Lyons. The last 10 minutes I've been having connectivity issues and I tried to turn my
Uh-oh.
camera off. And so I heard part of what everyone was saying, but I think including that specific language about DCF workers would give them the cover and the protection that they need, that we take that serious. If we just use generic terms or sort of blanket statements about who should get it, the DCF workers who are on the front line might get, washed out or forgotten about. So I would like to see some specific language about DCF.
I'm sort of with you on that, Senator.
And Senator, I would agree with that, and also the idea of close proximity to make sure that the 6 foot distance is stated, so that people who are in close proximity are also state workers who are forced to be in close proximity are also recommended.
I think I agree with you. That's very important. I talked over the weekend with a DCF worker, a contracted worker through the DCF who has a very severe chronic illness, and so has negotiated with her supervisors to work remotely for an extended period, but all her colleagues are being told to work with the public. So I think they haven't all yet been vaccinated, so that is a concern. It's an issue.
And I certainly hope that dosages will be increasing, and so that we can include everybody. And we're doing a good job. We need to continue and address the needs of all of our Vermonters.
So Jen, what have you got out of? Oh, go ahead, Ruth. Sorry.
I was just going to say, when did you want to send this? Because Jen could work up language and share.
Let me get there. That's right where we're going.
Okay.
So appropriations needs this today. And so we want to finish this within the next 8 minutes, or at least before 1 o'clock, so we can look at it and, if there anything egregious that stands out, we can identify that individually. Jen, what
So
are you
how much
thinking?
of the language that is currently there in this vaccine section do you want to keep? Do you want to keep anything about the vaccination clinics and mobile vaccine administration, or do you, okay.
In those underserved areas, and we could certainly mention Essex County and other areas, because Essex is has not received sufficient.
And so it sounds like you wanted to maybe lead with the state worker issue that you talked about, using some of Steve Howard's language around people who are at greatest risk for work-related exposure because of their work is in close proximity with people, and then specifically mention the DCF folks from his written materials. Is that,
Yes.
so start with that, and then
Yes.
Vermonters in very rural areas of the state, such as Essex County.
Yep.
And then Vermonters who are part of the Black, Indigenous, and people of color community, and people who are incarcerated.
Yep.
Yes.
Is that
That
sort of the
we
order?
haven't mentioned the courts. I I know Steve Howard's memo mentioned the court
Right,
system.
he does talk about the courts, the state colleges, the Vermont Housing Authority.
Why not? I seriously, it's okay to have a litany. The Appropriations Committee will take a look at this as well. It's a matter of getting the message out, I think, to the Department of Health and to the administration that there are whole bunches of whole groups that have yet to be served. It will relate very much to how much vaccine is available.
And Senator Lyons, you talked about, the state is requiring these people to do these jobs, and maybe there
Yes,
should be some language that reflects that. If state
yes,
state workers that are required by the state to do these jobs should have priority.
yes. That's far different from someone who is seeking a vaccine independently. We're not requiring them to get a vaccine, but we're certainly requiring them to be face to face with people who may or may not be vaccinated, and they can be carriers anyway. So it's a little concerning.
Okay, so I'm revising this to say you still don't have a specific funding recommendation, but you have concerns regarding COVID-19 vaccine distribution to particular populations. You wanted to call the Appropriations Committee's attention to this issue and the potential need for the health department or someone else to offer vaccination clinics, mobile vaccine administration, or other methods to ensure that, we'll say, or to provide. Anyway, I'm thinking that then I'll go into sort of a bulleted list that allows us to say more than,
Right.
without having a
And
very
other, I
run-on
mean,
sentence.
including, I think the list
Right.
should say including, so that it doesn't, that you don't have to be all inclusive. But, and then, but certainly those workers who are
I think
directed.
maybe we want to say in order to prioritize, is that,
Yeah,
access to the COVID-19 vaccine. It's hard to say including if you're sort of saying
Yeah.
prioritize. So I
Yeah.
think if you're saying in order to
prioritize.
prioritize access to the COVID vaccine to the following populations or following individuals or, and then we can have
Cohorts.
the
And
list.
you can say prioritize vaccination to underserved populations, including, you could define
Well,
them and
under-
then say including.
Underserved has a different a connotation. We're thinking of people who are employed by the state who are directed to work with clients and others in close proximity. So that, I mean, that's
Okay.
not an underserved population. Just trying to get at the need for vaccine is because they're in close proximity to others. That's a huge a risk corridor, and that's not really been addressed yet by the Department of Health.
You could say including certain state workers and underserved populations, including, and then you define it.
That's
So
good.
that I'm just saying, because there are other populations that we're probably not talking about
got
right
it.
now that tomorrow or today, later, we're going to hear from and we won't have on our list. So as long as we're sure that it includes the state workers that we're concerned about and these other underserved populations, meaning very rural, BIPOC, and incarcerated individuals, those are definitely underserved. And then the others
Sounds
are,
great. Sounds great.
that makes sense, Jen?
Does
Go
that,
ahead, Cheryl.
does that then take out the reference to DCF or to the courts, or is
No,
that going to
no,
be
it doesn't.
included as well?
No,
we
we
don't
would,
want to take that out. We don't
No.
want to take that out.
No. That's
we would say specifically certain state workers and then include those, and then underserved population.
Okay. Good.
That's what I have now is in order to prioritize access to the COVID vaccine to certain state employees and underserved populations, including, and then we start with state employees whose work-related duties must be performed on site and involve being within 6 feet of the public or coworkers. And then I'm going into the DCF list. That's where
Are you mentioning DCF specifically?
I
Can you
will
do
be,
that?
yes. Yes.
Okay.
So I'm including, I was going to do the list that Steve has, including family service workers, social workers, case workers, and investigators. Employed by families, and you want also the judiciary, state colleges, and state
Sure.
housing authority, and then other state employees.
Yes.
who,
What are
you
the
know,
state college workers that he's specifically talking about? Just,
I don't think he specifies.
He didn't say, but you can think about a one-on-one counseling service within a college or an organization. Whether they have protection or not, we don't know. But as things start to open up, it's important that they're protected through vaccination, I guess.
well,
That
this
would
is,
be
I
my
mean,
thinking.
he's just including all of the workers who are
All
in
of them.
the area. So, I mean, this is where I'm concerned about the list getting to be too broad, because it also, I mean, what about UVM? What about other, then it starts to sort of bleed in.
Well-
And so I think that you could just be generic and say, and other state workers, or something like that.
You
just
could, but UVM
after
is,
the DCF
yeah,
people.
UVM employees are not state workers. So the state colleges are. So I think that's a distinction that's being made, and they're directed, as much as they're directed to work with people in close proximity. I think that's the concern. And I honestly don't know what folks at in the state college system are directed to work in close proximity. I don't think any of us can answer that. So, do we want to leave it in or not? That's a question. Do you want
I
to leave
guess
it in
my
or not?
preference is that we be more generic after we hit those first couple, and just
Okay.
say, and other state workers who are required to work in close proximity, rather than calling out individual, because
I like that. I do like that.
yeah, then we
That's-
could,
yeah.
then we avoid getting into the why them and not me kind of
Yeah, I
conversation.
got it. That's good.
All right, so I have state employees whose work-related duties must be performed on site and involve being within 6 feet of the public or coworkers, including family service workers, social workers, case workers, and investigators employed by the Department for Children and Families, and other state employees whose work-related duties put them at the greatest risk for work-related exposure to SARS-CoV-2. Is that? Okay. Then
So
we
I
will
don't
have-
see any heads shaking the wrong direction.
That's great, Jen. Thank you.
Excellent work.
And then we had Vermonters who live in very rural areas, such as or including Essex County. What do you want?
Yeah, include Essex.
Yeah, I mean,
That-
Essex
yeah,
is doing a lot
that's
better.
the
They've
worst.
improved a couple percentage points over the last couple days. So, but I mean, if you want to use them as an example, but there are other really rural areas in Franklin County and all of our counties that have been underserved, I think. I think Rutland County is doing the best right now, though, you guys. It must be because you're both on this committee.
It's only because of this committee, trust me. Oh, what's going on with Addison? We got to work on Addison.
I know. I saw that. It's like 5th or 6th down the list.
And we have the big outbreaks in Chittenden County, so it's
Yeah,
the
oh.
population.
Grand Isle's doing really well too,
Yeah, they're doing
in terms
well.
of percentage. But Rutland's #1 in terms of percentage vaccinated.
All right, shall I put this back up and then you can see what
Yeah.
I've just put in? I'm just.
Yeah,
saving it.
let's do that. We may as well
And
see
then
what
if
we
you're on-
have.
Okay. Here's that new language. I'll make it a little bigger for you.
That looks great from my perspective, Jen. Thank you.
You're very welcome.
Senator Hooker, I know that you, and I also think Senator Terenzini, were concerned about workers at homeless shelters. Have they been gotten, or do you want to add them to the list? Just thinking of others that have come up on this in this committee.
I know that some shelters in Chittenden County had been taken care of, and I believe that the shelter that we were concerned with has been taken care of in Rutland. But
Yeah, most of the homeless shelters are have been helped. And there's been very limited outbreaks in shelters across the state, which is really outstanding to see. I think this really gets at the issue that was brought to us. So I wouldn't go any further than that.
Looks good.
Yeah, I think that the BIPOC community is receiving significant attention. So it doesn't hurt to be a little bit redundant there. Those who are incarcerated have received attention, but there's less attention than probably they should be getting. So that I think we should leave in. And so is that it for the letter, Jen, then?
That's it. I put today's date on it at the beginning.
Oh, good. All right, so committee, so this serves our purposes, and communicating with appropriations. They're going to want this. They want this letter ASAP. We've worked really hard on all of this, and I know that it will be greatly appreciated by the Appropriations Committee. I know they have said that. So, anything else? Are we good with just sending it along then? Yeah, good. So, Jen, if you don't mind getting Nellie a clean copy to put up on our webpage. I know there are still concerns out there, or there will be concerns out there perhaps from some folks who are out on YouTube, including the Vermont Care Partners. And we'll try to listen to whatever we hear from them going forward. But as I said before, I think this makes a lot of sense right now based on what we've heard. And we'll see how it goes when it gets to appropriations, whether they like our $8 million or not.
Well, I sent it to you, Madam Chair, and to Nellie. So
thank you very much. And then I'll send this along to, unless you want to send it on my behalf, Jen, to, I'll send it to Senator Kitchell.
It's probably better coming from you.
Yeah, I will. I'll send it to her. And who's Chrissy Gilhooly?
Chrissy.
Yeah, okay. All right. We're over time, but we've done a lot of work, and thank you for that. Thank you for all your work, committee, and Jen. We've been, seems like more time than ever. Okay, so we're good. Tomorrow morning is a big morning. Nellie, can you take us off YouTube for a minute?